Hi, my name is Louisa Bennervain. I use she, her pronouns. I am the coordinator of the New York State LGBT Health and Human Services Network, known as the Network, if you shorten it, which we very much try to.
Hey, I'm Barbara Warren. My pronouns are she and her. And I worked at the center, here at the center, for over 21 years. During that period of time, and we're going to talk a little bit about that, the network was formed. And of course, the center was kind of at the center of the network's formation and development and facilitating it as a statewide entity.
Hi, I'm Richard Burns, he, him, his, and I was the center's executive director for 22 years. And the network began because in 1994, Rudy Giuliani was mayor of New York. And the organizations in our community that received city dollars to provide services to LGBT people in need of services were worried that this homophobic mayor, this Republican mayor, would jeopardize and threaten the hard-won dollars that went to provide services to our community.
My name is Kim Dill. I use she, her pronouns, and I work with Sage Upstate, serving older LGBTQ people in Syracuse and Central New York. So it started in Syracuse in 1997, and for 6 years they were all volunteer, but then they heard about this network that had formed and was advocating for state funding, and they actually they joined it and they applied for a grant and got it, and that's how I got my job at Sage all those years ago.
Once we started growing our practice and we started realize, it became very clear that the patients that we served had lots of different needs, more than just medical needs. There were a lot of social needs, there was employment needs, there was mental health needs, and we realized that we really needed to expand our services in order to meet the needs of the patient.
My name is Jack Kavanaugh. He, him pronouns. I am the executive director of GLIS. So GLIS has been around for 41 years. We emerged out of a lot of organizing around HIV/AIDS in the 80s as wanting to provide support and resources to LGBTQ plus youth. So I think the biggest thing for us was really underlining the importance of how much we needed to have trusting relationships with the youth so we could really give out that information. And so that's really the core of what we do, is we build those trusting relationships both between staff and young person, but also between young people, and then as well as their parents and families and schools. But the more we can have that web of networks that trust sort of operates on, the easier it becomes to disseminate information about public health emergencies, but also just kind of everyday resources. And so one of the things we really focus on is expanding out that sort of web. And COVID initially, I think, really impacted us because it forced us to be thoughtful of what that looked like. So if we're doing what we need to do to build that strong network of trusting relationships and support and mutual support for young people in the community, it's the same idea of what we need to be successful. We can't sort of be in a silo thinking about what we think is best, when I could just call someone who's doing this work in Albany and be like, hey, what did you do for XYZ problem? And they can be like, hey, we tried this. And I can be like, great, that's perfect. That's what I needed, or vice versa. And instead of having to spend a month trying to figure it out myself.
I think there was a growing demand for services that were local, where people are in their communities, not just, medical services and mental health services, but also social support, like where people live and work and play and love and all of those things. So people wanted to be able to access things in their backyards, right? Which makes sense, and not have to travel hours to get to them.
And so one morning, Frances Conroyther, who was the executive director of the Hedrick Martin Institute and the Harvey Milk High School, and I met for breakfast in the West Village and came up with a scheme that we needed to pull together all the queer health and human services providers in New York City to organize and protect one another and all of us against a potentially homophobic mayoral administration. So the very first meeting after that breakfast took place at Gay Men's Health Crisis in the office of the executive director at the time, Jeff Richardson, right here in Chelsea.
I think the strength of LGBT organizations around New York State was that they really had reached into the community of queer folk and their allies who were constituents of the people at the New York State level that we had to convince needed to support us, and at the federal level in, the corridors of Congress, right, that we needed to support us. I would bring them into these offices and say, I live here, I vote here, these are my needs, this is my community's needs.
For me, it's like we're all in this together. So. Truth is, we can't win without each other. We're one community, regardless of region, and we need each other. So, particularly when it comes to passing legislation. So, a lot when I was doing work on the state level, a lot of our New York City-based senators were with us on our issues, and really it was working with folks in Rochester, Buffalo, the Hudson Valley, Long Island to get their folks to move over to our side.
Network members now are spread all across the state of New York. They get to see and work with 1.5 million New Yorkers every year, which is an impressive amount of people. Our coalition works in every county of New York State.
We have a weekly digest, which is a weekly newsletter that goes out, so folks across the state are aware of upcoming job opportunities, different events across the state, and of course different workshops, technical assistance, and capacity building opportunities. So we just try to make sure that all the information that folks give to us across the state is then immediately redistributed to all network members and folks who aren't even network members who might benefit from that information and those resources.
I also want to be very frank, right? The state of the world is horrific. The state of our communities in this country is terrible, it's frightening. So many states, in this country are banning pretty much our existence. And that is really difficult, that is a complicated conversation. We are receiving so many people from other states, from other countries who are here, looking at freedom, that safety, that feeling of being yourself and to being with other people like us. This is our community, and we cannot take this for granted. This is something that we have worked for 30 years to build, and it is worth celebration. So thank you so much, and celebrate it with me.